What are prior authorizations? Hello, this is Dr. Siddharth Ambar, expert in rheumatology and regenerative medicine, physician here at Chicago Arthritis and Regenerative Medicine. Question asked of me recently, which I think is worthwhile discussing with the general public, is what, in God's name, are prior authorizations? You could probably Google this and figure it out yourself. I'm going to give you a physician perspective so that you have a more well-rounded perspective on what prior auths are and how you can advocate for yourself. In the ideal scenario, when it comes to decision-making about your medical condition and what's going on with you, it would be between you as a patient and your physician. Your physician is listening to you, examining you, understands what's going on with you, figuring it out with you, and deciding what are the next steps. Whether that is with diagnostics to figure out what's going on, or whether that is with treatments to how to actually treat what is your issue. That's the ideal scenario. The reality is that as time has gone on, the cost of care has ballooned like crazy. There's a ton of reasons for that. Some of that may be non-economic, but some of it is just some of these treatments are more involved and they take a long time to figure out, and there's a lot of work involved in it. So the cost of care has ballooned over time. In America, we utilize, in large part, private insurance, some government insurance, and over time, even Medicare is now becoming more of a privatized thing with Medicare Advantage plans. And because of that, we have now involved health insurance to help us decide what treatments and diagnostics are appropriate and what are not. In order for them to do that, they require a prior authorization process. Prior authorization is where your physician or caregiver or hospital basically has to ask your health insurance whether they are allowed to do a certain diagnostic test or a certain treatment. It makes sense because in the best case scenario, you have the health insurance, which works for you as an individual, is basically making sure that what has been recommended for your health is safe and appropriate for you. That's the ideal scenario, right? A benevolent overseer making sure that you're not getting ripped off and that everything is safe for you. Why can this be a problem? There's a couple of reasons. Number one, is it only about the money or is it about the safety as well? All right. If it's about the safety, then you would think your physician would be the primary one who's helping to make that decision with you. When the health insurance company jumps into this process, they are now in some ways practicing medicine because they're making decisions based on your care. That is dangerous, and that's not where they're supposed to be fitting in. So then you ask, well, what if it is primarily an economic one? Okay, well, to begin with, how do we know what is appropriate based on the cost? Who's making that judgment call? Apparently it's your health insurance company, but maybe sometimes it should be you as well. Now, part of that is it only about the cost? Because what you started to see is that health insurance is requiring prior authorizations for not only the big expensive tests and treatments, but also for even some of the smaller ones. In rheumatology, you'll find health insurance now requiring prior authorizations for things, for generic medications that have been around off patent that are very cheap for decades. Things that are required for autoimmune conditions, essential for autoimmune conditions, that probably cost them $100 per month, if not even that amount. They'll require prior authorizations for that. Delaying treatment resulting in more suffering. That doesn't seem right. Then the next question is, are they making decisions that are in your best interest, or are they at times making decisions that are in their best corporate interest? If they're making decisions that are in their best shareholder interest and not their client interest, the patient interest, then they may be causing more medical harm. So, as an example, if the prior authorization process is an automatic thing, then are they doing it efficiently or are they dragging it out? So if what's involved in the prior authorization process is that your physician or hospital needs to submit some records, they then get some medical forms back that they then need to answer and then send back. Are those being responded to quickly? Are they taking days or weeks on end to respond to? And when that happens, are they auto-denying or are they appropriately allowing when they should be based on medical criteria? Auto-denying, does it then result in more prior authorization process to appeal? Does that appeal then require more paperwork? Is it then adjudicated by someone who has the requisite experience and expertise based on their medical training? Or is it handled by people who don't have the right expertise, or by people who have no medical training, or strictly based on an AI process? If it's handled based on an AI process, is that a black box that has no explanation or accountability to the general public or to you as the patient, the client? Or is that something where it's clear what their rules are? More often than not, currently, the accountability is not there, which is a problem. So that is where prior authorizations can be a problem, in that they can delay your care, they can deny your care, which can lead to more suffering, progression of your condition, and more problems. So, is there accountability? So what can you do in this prior authorization process? First and foremost, stay in touch. Stay in touch with two different parties. Stay in touch with your physician or hospital that is going through this process for you. Make sure that they've submitted everything appropriately. Make sure they have all the requisite information from you that they need to submit it appropriately. If they don't, it'll slow down the process. Number two, stay in touch with your health insurance. Keep in mind they work for you. You need to stay in touch with them to make sure that they are adjudicating this appropriately. You need to stay in touch with them to make sure that they are processing this appropriately so that it's being handled appropriately. And then next, you do need to advocate for yourself. Understand the health insurance works for you. You are their client. As much as your physician or hospital will fight for you, the reality is we are a cost to them. All right? As a patient, as a client, you actually pay them in some way, shape, or form. So you need to advocate for yourself. You need to push for yourself. If they are denying a treatment or denying a test result, you need to push for yourself. A common thing that you'll see insurance do is they'll push back and they'll say, well, we need X, Y, and Z from your physician. Make sure they've received that. Make sure they're not delaying. Make sure they're not denying and delaying, right? That does happen, right? Because they have other interests that go beyond just what's right for you. And then the last part of that is, if you receive your health insurance through your employer, understand that for larger employers in particular, your HR department can be helpful to advocate for you, right? They're advocating not just for you, but for all their employees. That has an effect when it comes to influencing their health insurance. Also keep in mind that if your employer is self-insured, most large employers are, that means that they are not just outsourcing all the decisions to a health insurance company. They may have a health insurance company that is helping them with paperwork, but they themselves have the final decision making in that kind of setup. They probably have more say in terms of helping you get what needs to be done appropriately for you medically. And then lastly, advocate yourself on an even bigger level with your local politicians or your state level politicians. They need to know what's going on. In the end, health insurance, these are private companies. They will push for what they want. You need to push for what you want. If you push for what you want, you can get the health insurance companies to be more accountable and better regulated. Do that, and the prior authorization process will not just be about denying you care, but it will be about helping you, and it will be keeping the health insurance companies accountable to what is important to you, which is your health and your care. Hope that's helpful about what it is about prior authorizations. They are the bane of our existence as physicians, but they are what they are, and hopefully we can do better over time. Thank you for your time, and until we connect again, have a good day and live well. Bye-bye.